Hey guys, Dr. Nick Howland here, board certified plastic surgeon. Let's talk a little bit about hair loss. One of the most common questions I get is, why should I do it here? Why don't I just travel to Turkey? It's gonna save me money to travel Turkey. And my answer is, you are right. It will. It will save you money to travel to Turkey because I can't pay the technicians and the people I need to less. And so it has to be more expensive here in the United States. The benefit to doing it here in the United States is safety and peace of mind. If something does go wrong, if you get an infection, if you have anything go wrong during the procedure, being in a foreign country is not the best for you. Oftentimes, if you travel to a foreign country and then have a complication from that procedure, insurance will not cover fixing what it might take to have those complications fixed. So if you go to Turkey and have a hair transplantation, come back to the United States, get an infection that lands you in a hospital, insurance is not going to cover that hospital stay, and that can get really expensive. So for me, and what I tell my patients is that peace of mind is oftentimes worth the extra cost that you might pay by having it here in the United States. We're also a very safe Quad A certified facility, and so you're gonna get the highest standard of care with the safest protocols and the most sterile environment that you can anywhere in the world. Some of the other questions I have are how the procedure works and what the downtime is, how long it takes. We're gonna show you the actual robot, and I'll talk a little bit more about what the procedure looks like from start to finish. But let's go back, let's show you the robot, and we'll answer those questions there. Here at my office, we use the gold standard, the state-of-the-art robot. It's called the ARTAS robot for hair transplantation. And this takes all of the human element out of hair transplantation. So instead of cutting a strip of hair from the back of the head, the robot uses AI software to actually harvest one follicle at a time, the graft that we then place, and the robot places the graft, again using AI software. The reason we use that AI software is it maps the back of the scalp and it selects the grafts in a random pattern generated form so that you can't tell that it was extracted by human hand. It just looks so random that it looks natural and normal. And when you put the hair in, it's not a straight line across. It's actually generated to look like some of the irregularities that we have in our own scalp and our own hair. So the results are the best you're gonna get with this robot. The graft has a 98% graft take. This is the same robot that patients are traveling all over the world to places like Turkey and Mexico to have their hair transplantation done. We're here with the ARTAS 9 robot, as we like to call her, Hermione Granger. Or Scalptimus Prime. I think Scalptimus Prime won the vote that we did. Avery is my nurse who is the pro at all things hair transplantation, and she is in the room with you during the procedure the whole time. You want to talk a little bit about what you do, Avery?
So I usually just operate the robot. I kind of guide it through the process, helps collect the grafts, making sure the grafts are functioning properly, how many we're taking, and then we're also just watching like an up-close visual on the scalp of how it's working.
So when you come in for the procedure, you're gonna come in, you're gonna see Avery, myself, and the rest of the team. We shave your head that morning. For our female patients, we actually just shave only the area we need. You don't have to shave your entire scalp. But for our male patients, we shave the entire head. I will mark the hairline, like how far we're advancing and where we're filling in. And then we bring you back in this room and we numb the scalp. That's the worst part of this procedure. We're gonna give you some medication so you're feeling good. But after that, it is a lot of needle injections in the scalp to numb the entire scalp. Once you're numb though, you're just in here hanging out, chilling for a good 6 hours. Most of these operations take anywhere from 4 to 8 hours. And so you're here hanging out with Avery, who is a great person to hang out with most of the day. And then we've got some other staff that are in here as well. There's TVs that you get to watch, and you can have your own iPad or phone, and so you really just get to hang out. We usually bring in lunch. You take a break halfway through the procedure, eat some lunch, and then we continue on. So once your scalp is numb, you're in this chair face down for 2 to 3 hours while the robot harvests the grafts. This is kind of the actual action arm of the robot. There is a scalpel that's placed in here, and as the robot moves, it will position itself over the patient, and then that scalpel will drive itself into the scalp and take out one follicle at a time. While it's taking out the follicles, we have a team that is taking those grafts and then working under this microscope over here and breaking those up into 1 and 2 follicle units for later grafting. When that's done, we put you back over on your back on the chair, and then we have 2 options for actually grafting the follicles. Option number 1 is we use hair techs that come in and they graft them manually by hand. Option number 2 is using the robot to graft them robotically. Both are good options. We often incorporate both into the procedure to save time and to be more efficient. Once you're done with the procedure, we clean you up, we give you your medications, you go home, we see you the next day, make sure everything looks good. We see you again in a week, a month, 3 months. And then really the hardest part with this procedure is patience, because you're not gonna see your full results for 9 months. And so you want 3 full cycles of hair growth, which is 3 months each cycle, before you can say, okay, this is my results. But other than that, that's the nuts and bolts of our hair transplant robot and the team. Come see us. This is state of the art. This is the best place to have any hair transplantation procedure done.